Find all diagnoses for all hospitalizations, ED visits, and outpatient visits in a temporal window post-index. Tutorial 28, Smart Reports at Montefiore. For those interested in learning how to use cohorts to solve accountable healthcare questions, please read Riddles in Accountable Healthcare, available from Amazon in paperback or Kindle. At Montefiore, I've told you that we have a number of manuals that you can use. The classic user manual for Looking Glass, which I suggest you read, particularly if there's a topic that you want to get into deeper understanding. And another manual called Ad Hoc Reports. Ad Hoc Reports is a series of reports that have been associated with Looking Glass and its security features to allow you to ask and answer questions that are sometimes more complicated to do with the rest of the tool. I'm going to show you a few examples of these, and in particular, I'm going to show you the Smart Report Diagnosis Summary Report. So, to get to the Smart Report, left-click on Smart Reports, and left-click on the plus sign for Ad Hoc Reports. You're going to see among the different reports is something called Diagnosis Summary. Left-click on that. What we want to do here is we want to take a group of patients and we want to follow them from their index date for a period of time. And we want to see all their hospitalizations, all their ED visits, all their outpatient visits, and all the diagnoses associated with them. In order to do this easily, we basically select a cohort. We're going to follow up these patients from their index event. Let's find those patients that were our pneumonia female patients that were discharged in 2010. We're going to follow for a risk window of 180 days after the index date. The event types we're going to be interested in are all of them: inpatient, outpatient, emergency visits, and ambulatory surgery. I'm going to ask for both the ICD-9 codes and CPT-4 codes. The output is going to be a report format. And I'm going to run the report. It asks me whether I want identifiers. I don't need them, and I'm just going to get the report. And what the Smart Report now does is provide a very formatted report that gives you this information. So you can quickly look at the cohort and get a sense of what's happening to them. I'm now going to output the report by left-clicking and exporting this report. I have a number of choices. I'm going to bring this up here so you can see it. I'm going to output into a PDF. I could have put it out into Microsoft Word. And I'm going to export it. And now what I will have will be a PDF document that will have, for each patient, the index admission and all the subsequent admissions, ED visits, outpatient visits for the next 180 days. So you can quickly scan it and get a sense of what are the problems these patients are seeing. Everything else in Looking Glass is fully self-documented, telling you exactly who the cohort is, number of medical record numbers, the risk window, and what we're looking for. You can see there are 2,135 pages, so this is not a small report. And here, which I will only show you the report itself, I will not show you the MRN, because clearly a medical record number is not being shown, it's just the patient pointer. You can see the inpatient visit, present on admission, the diagnoses, the next outpatient visit, the next emergency room visit. It allows you to get a very quick sense of what the patients in this cohort look like in terms of their hospitalizations, their ED visits, and their outpatient visits.